Everyone knows about the blood pressure, but it's interesting to know there's a lot of other pressures in the body which have different medical uses, especially in diagnosing different medical conditions. Hello my friend, welcome back to Chatterdocs. I'm Dr. Tor and I'm an internal medicine physician. In this channel, I talk about topics related to medicine and health, and I believe learning about health and medicine does not have to be boring. So if you're new here, please consider subscribing and turning on the notifications so you will never miss anything. Number 1, blood pressure. Everyone knows about blood pressure, right? Well, if you don't worry. Click up here and watch my other video on blood pressure. Basically, blood pressure is the pressure of blood in the vessels. It's been measured and used for hundreds of years in medicine. It's basically a part of your vital signs. How it measured is, again, everyone knows, they place a cuff on your arm. It creates a high pressure so the blood flow in your artery would stop. Then we will slowly release the pressure and listen, or in case of digital machines, sense for the start of blood flow. That number indicates the systolic pressure, which is the blood pressure when the heart is pumping. Then we keep listening to the pulse until it goes away. Then that number is the diastolic blood pressure, or the pressure of the blood when the heart is resting. So the final number for your blood pressure will be 120/80. For all the pressures in the body, there's a normal and healthy range of the pressure. If it's too high or too low, we should be worried and start treating for different conditions. There's another method of measuring blood pressure which is used in the ICU or intensive care unit, where we can put a small catheter directly into someone's artery, here or any other big arteries in the body, and then the machine can directly and continuously check the blood pressure, which is very useful in critical patients with labile blood pressures. For example, the patients who are receiving continuous medication to keep the blood pressure up, called vasopressors. Did you know that we can directly measure the pressures in your heart or lung? In some conditions like heart failure, we would like to check the pressures in the heart chambers directly. So we can use a catheter to go directly into your blood vessels from the wrist or your groin into the big vessels and then the heart chambers itself to measure the pressures inside the heart. And it's interesting to know the pressure inside each of these places is different. This procedure is called right heart catheterization. By the way, what does millimeter of mercury mean? According to Merriam-Webster dictionary, it means a unit of pressure equal to the pressure exerted by a column of mercury 1 millimeter high at 0 degrees Celsius and under the acceleration of gravity and nearly equivalent to 1 torr. Torr! That's me! I didn't know I'm popular! Basically, it's a unit of measurement. You don't need to know exactly what it means. You probably knew about these two pressures, but what other parts of the body do they check the pressures from? Let's start with the brain. Yes, we can check the pressures in the brain with a very invasive method. They basically can put a probe inside your brain, inside the ventricle, to measure the pressure in the different parts of the brain. Now, this is not a procedure that's done in the office. This is done for patients who are very sick in the ICU, usually patients who had trauma or a tumor or a brain surgery or something that can cause increased pressure in the brain or in the fluid around the brain, which can be detrimental for the brain cells. So we precisely and continuously monitor those pressures and then decide what to do or what to give to the patient. The pressure inside your eye can also increase, which is called ocular hypertension, which can cause glaucoma, which is a serious eye disease. To check the pressure of the eye, your doctor will give you drops to numb your eye and then put a tiny probe on your eye, which applies a little pressure and then it measures the pressure of your eye globe. Sometimes it's done by a puff of the air.
What? A small puff of air. Now come on!
There's also newer devices that you can buy and check your eye pressure at home, which is recommended for people who are having ocular hypertension. We talked about blood, heart, lung, brain, and eyes. Now it's ear's turn. Your eardrum or tympanic membrane is situated in your ear in a position that it has air in front of it and at the back. And these air pressures should be equal so the tympanic membrane can freely move and absorb the sound waves and transmit those to the bones in the ear to be sent to the brain for interpretation. If your eardrum cannot freely move due to any condition like stiffening or fluid accumulation at the back, its function will be disrupted. There's a test called Tympanometry where they put a probe inside your ear and they puff some air inside and then they measure the movement and the pressure changes inside your ear canal, and they can tell if the eardrum is freely moving or not. The pressure inside your abdominal cavity can severely go up due to accumulation of fluid or blood, which can happen in the setting of trauma, abdominal surgery, severe infection, or burn. In this situation, we would want to monitor the pressure inside the abdomen to diagnose intra-abdominal hypertension or abdominal compartment syndrome. because if this pressure is severely elevated, it can disrupt blood return to the heart and it can be deadly. The way this pressure is measured is through a catheter that goes inside the bladder, and then the pressure inside the bladder is measured, which is indirectly indicative of the pressure inside the abdomen. Esophagus is the tube that connects your mouth to the stomach. When you swallow, the muscles of the esophagus contract and push the food into your stomach. That's why swallowing is not all dependent on gravity, and you can even eat while laying down. In some disease and conditions, the pressure inside your esophagus is too high, so the swallowing process is disrupted. Conditions like diffuse esophageal spasm, in which those muscles are abnormally contracting all the time. In these situations, we need to do esophageal manometry, which is basically measuring the pressure inside your esophagus. A probe will go down and they will ask you to swallow, so it will measure the pressure inside your stomach in different stages of swallowing. Measuring pressures inside the limbs. Muscles and bones inside the arms and legs are arranged in different compartments, which is separated by a tissue called fascia. These compartments are tightly sealed. If for any reason like trauma, infection, edema, increased fluid, the pressure inside these compartments are elevated to a dangerous point, then the blood flow to the muscles will be stopped and then the muscles will die, which is a very dangerous condition. In these situations, we can put, again, a needle inside the compartment and measure the pressure inside that compartment. Normal pressure inside the compartment usually should be 0 to 8, and if it's increased over 30 millimeters of mercury, it's called a compartment syndrome, which needs an emergent operation called fasciotomy, which is not a nice operation. They basically cut all the fascia and skin and leave it open until the pressure goes back down. It's ugly. We talked about almost every organ in the body, but I think we're missing the most important organ. Oh, penis! Penile pressure. Yes, my friend, that little organ also has pressure and different ways to measure it. To understand and study the pressure inside the penis tissue for erection abnormalities, we need to study the intracavernous pressure, or ICP, not to be confused with intracranial pressure, which is usually done by looking at the blood flow coming into the penis and going out. Of course, the ICP can also be measured via a needle inserted into penis. No, but that's too invasive. It can also be done with Doppler ultrasound, which can measure the blood flow inside the penis. Thanks for watching this video. I hope all your pressures stay regulated and you never need any needles inserted anywhere in your body. If you like this video, don't forget to hit the like button and share this with your friends. You can watch my other videos right here.